Morning.
Good morning. We'll give folks a minute to join. It's good to see everybody. I think we shared that Massachusetts, along with six other New England states, is in Springfield. So I'm coming to you live from Springfield, the 413, for the New England States convening for the Alliance for Early Success. And then later today, I'll be back in Boston for the Zance Innovative Challenge, which is happening today, this afternoon. Um, so I'm emceeing along with Paul Belsito. So, and then I'll be back here tonight. So it should be a good day in the 413 and 617. So Jeff, we're so happy to have you with us today. I know you probably have slides, so you should be all set to share them. And as we talked about, our first question for everybody in the 9:30 call is for you to tell us a little bit about you and how you came to be in your current role.
Okay. Uh, Good morning, everyone. Um, my name is Jeff Liebman. I'm a professor at the Harvard Kennedy School, and one of my hats I wear here is as director of the Rappaport Institute of Greater Boston, which tries to improve the connections between Boston area universities and the communities that we are involved in, and particularly the government officials and policymakers who could potentially benefit from the expertise that our universities in the Boston area have. And I guess the story of how I ended up doing the current project really goes back 22 years to when my daughter and Amy Kershaw, the Commissioner of Early Education's son, were in, I guess, toddler care together. And so I got to know Amy, and then was talking to Amy about a year ago, and she was describing some of the policy challenges that the Commonwealth is facing. And I would say two things happened. One is they sounded very similar to things I'd worked on when I was on the original Obama campaign, helping to put together the campaign version of the Affordable Care Act. And secondly, usually what I do when there's a policy question is I play the matchmaker role and find some other faculty member to do it, but this one seemed too good to hand off. And so I decided that this is a project I should do myself. Part of the reason I took this on was I thought the analytic issues were interesting, and the second was that there was a lot of new data because the C3 program, the data that 90 or so percent of providers are participating in that, and the data they supply as part of that makes it possible to understand to a much greater extent what's going on in the early ed market in Massachusetts. And so it seemed like there was something new to be done that hadn't been said yet. And so that led to this project.
Great. Well, we know there was an event last week at the Rappaport Institute, which many of us were attending. We know many people couldn't get there, so we're so glad to have you here today. So why don't you tell us about the report?
All right, I think I'm going to share the slides now. And
Great.
let's see if I can get this working.
This is the hardest part of the 9:30 call, always. So far, so good.
Okay. Just one other thing I should say before I get started is this was funded in part by the Commonwealth Children's Fund. And so I'm very grateful to Lydia and Melora for basically making it possible for me to hire a research assistant to do this work. And also, you'll hear in a moment that as we started doing this work, we realized that even the data the state had wasn't sufficient to answer one of the big questions, and I needed to go field a survey, and having resources made it possible to do that. So thank you to Lydia and Melora. Okay. So basically, here's how I define the problem I was addressing in this report. Really around three questions. One is, how can we design a more comprehensive system that builds on the provider base rather than disrupting it? So I ruled out hey, let's set up a French system and have the government run a completely new system or something like that. That was not within the parameters that I was thinking about. The second thing that I treated as a constraint was that if we put additional dollars into the system, we want it to be giving us something new, like higher quality or more slots, not simply reducing the cost to people who are already in the system. So, as whatever we're going to try to achieve, I want to try to achieve it at the lowest cost possible, so that this might be, so without, given that we're unlikely to have all the revenue we want, that we can get as far as we can in terms of having more kids in care and having higher quality care. And then the third thing that I took as sort of a constraint here was to try to write down a path or steps on the way to an ideal system that would be in the right direction, such that whatever we get done each year doesn't require backtracking whenever we get to whatever the ideal system is. So that's how I sort of thought of this overall policy problem. And there are really three sections to the report. The first talks about the economic rationale for more public investment in early education. The second talks about what the current state is of the market in Massachusetts. And the third discusses the key issues, I think the key trade-offs, the key decisions, thinking about the future and what the next steps forward. So let me start with the first topic, which is the economic rationale for public investment. And I guess what I want to say is there's one thing that's definitely a puzzle and another thing that's definitely not a puzzle. So the thing that's a puzzle is, given all the overwhelming evidence that early education is so important for child development, and that achievement gaps are basically already about as big at age 5 as they are at age 16, why doesn't society invest at least as much in early education as it does in K-12? And so one thing I do in this report is do my best to figure out, and I think this is a new number, if you take the federal and the state and the city and town support for early ed, and how I'm only looking at the folks who are too young for kindergarten. I'm not looking at the after school care in my report. If you do that, how much is the government in total spending on early education in Massachusetts per child? And it looks to me like that number is about $3,700 compared to $20,000 in K-12. So, I think this is what I would describe as the puzzle. The thing I would say that is not a puzzle is that we are where we are right now, which is families struggle to find care and afford it. Providers struggle to hire and retain talent and maintain the quality they want. The reason that's not a puzzle is that there are clear market failures. There are reasons. It's just there's no reason to think that without a substantial government involvement in this policy area, and substantially more than it's doing now, that we're going to get to the ideal outcome. And that's really for three reasons. The first is that care is just, this is just too expensive for people whose incomes are in the bottom, say, third of the income distribution to even, contemplate paying for it fully out of pocket. It's sort of like healthcare, right? If you take a family making $50,000 a year, and a family healthcare plan these days costs $26,000 a year, it's not even like remotely possible that they're going to be able to afford it, and therefore you need a government program, to provide free health insurance for families whose incomes are in the bottom range. The same thing with childcare. If you're making $50,000 a year and an infant slot costs $30,000, there's just no way. And so number one is if we believe that we want every child in society to have a good start in life, government's going to have to pay for that for people whose income is low. But in addition, even for people who, like, in some lifetime sense, are not in like the bottom of the income distribution, often people who are have kids, you have kids when you're 28 or 32 or whatever, and you're early in your career and you don't have a lot of income. And so even if, on a lifetime sense, by the time you're at the peak earnings at 40 or 45 or 50, you're going to be, doing completely fine, making whatever, some large amount of money. That doesn't mean you have the money when you're 28 and have kids. And so even if your 60-year-old or 50-year-old self would have been happy transferring money back to your 28-year-old self so that you could have bought higher quality or more childcare, you can't do that. And if you go to a bank and say, hey, this investment in my child is really worth it, lend me money, they're probably not going to say yes. And if the 1-year-old child goes to the bank, well, first of all, they can't get to the bank. They don't drive yet. But if they somehow get to the bank and try and say, hey, if you invest in me, there's going to be a big payoff, obviously it's ridiculous. And so that's the second reason why government has to get involved here. Essentially, when we use income taxes or whatever tax to tax people, we're disproportionately taxing people when they're in their peak earnings and tend to be when they're older. And so if government taxes and then pays for ed, we're solving this borrowing problem where people can't invest in this, even though it's a very high rate of return. Economists call this problem a liquidity constraint. So we're solving the liquidity constraint problem. And then the third economic issue here is because centers are pretty small typically, and because they rarely get paid, they get paid, if they're lucky, marginal cost, often just below marginal cost, and then they have to go raise philanthropic resources. If your classrooms aren't all filled, the numbers don't work. And so there's incredible disincentive to open another classroom, because if you only fill 2/3 of those slots, you lose money. And so that risk, you can't go to an insurance company and say, give me insurance against the chance that my slots aren't all filled. And so I think there's also a sort of market failure there that calls for government to basically pay more or subsidize the openings of new classrooms, sort of for 1 year or something, year and a half, to pay more to get the new classrooms opened, until people have time to fill them up. And this is a pretty common problem. There are a lot of sectors of the economy of social services where the way it works is you have to keep all your slots filled, and so you undersupply capacity and keep long waiting lists. If you've ever tried to think about the market for like treatment for people with opioids, same thing. You got a cousin who needs treatment today, and they're going to go tell you, well, we'll have a slot for you in 4 weeks. And again, it's the same thing, because we don't pay for unopened slots, for empty slots. It's in everyone's incentives to fill all the slots and keep wait lists, and that reduces the supply of things that we need. So those are the market failures. I guess the third thing I do in the economic section of this, the first section of this report, is talk. I think the reason we're to invest in early ed is so that the kids will have better life outcomes. There are other economic benefits. This can contribute to reducing gender disparities in the labor market. I have talked about that quite a bit in the report, and it will cause more women, particularly, to be in the labor in the paid labor market. And that higher employment will increase the average income, the gross state product in Massachusetts. And I have some sort of back of the envelope, hand wavy calculations in the paper that say that if we really did a pretty ambitious program, we could increase the size of the state economy by about 0.5%, and that would produce about another $200 million of tax revenue. And so if you're sort of imagining, doing something that costs, I don't know what it's going to cost. Let's suppose it costs $1.5 billion. You might get a $200 million offset from the additional tax revenue as you do that. Okay, that's the economic section of this report. Amy, should I just keep chugging ahead, or should I stop and have discussions after each section?
I think keep chugging ahead. I'm monitoring the chat. I also put the link in the chat of our blog post with the report, but I'll just highlight that Donna Danette added, I love that you lead with the child outcomes before the economic ones. Thank you. And I added a puzzle is a diplomatic frame to our underinvestment.
Yeah, thank you for both of those. And because I'm have the slides in front of me, I can't see the chat in real time. So thank you for sharing this with me. Okay, I'm going to go to the second section of the report, which is the state of the market in Massachusetts. Okay. First thing we can now say, because we have the C3 data, is we know how many kids are in care and what % of young children are in care. Something we actually didn't know. We knew license capacity, but now we actually can tell. I mean, there were surveys out there, but this is the first time we've had really good data on this. So what you can see is 52% of children who are too young to be in kindergarten are in formal childcare, where formal is defined as a childcare center, a licensed family childcare, or a public pre-K. And that varies quite a lot by age. 24% of infants are in care, 40% of toddlers, and 71% of preschoolers are in formal care. Okay, so you see that number, 52%, and as you sort of think about the policy objective, there's a big question, which is, well, what should we be aiming for? Not every kid should be in care. Lots of people, especially when the kids are young, prefer to have the kids at home. But it's a pretty, there's a lot of uncertainty. Should we be aiming for 60%? Should we be aiming for 95%, 85%? And So in the report, I make some progress on this, and then the survey I just fielded that I'll tell you about in a second, I make, I think, further progress on this. So what I point out in the report is I reprint a very nice chart from one of my colleagues at the Harvard Ed School, where they were studying 3 and 4-year-olds in Massachusetts and what kind of care they were in. And you look at the part on the left here, and you can see that for people in the bottom income quintile, about 61% are in formal care. And in the top 2 quintiles, 62, basically the exact same amount are in care. But in the middle, it's about 45% are in care. So what's going on? Well, probably what's going on here is at the top, people can afford care if they want it. At the bottom, people get subsidies from the state, and so they can afford it. In the middle, they can't afford it themselves, and they don't get any help from the state, and so they use less care. And so this is, I think, a very, very clear evidence that we need more, that we're not getting, that the 52% is not the desired amount of care, that there are a lot of people in those middle groups who would almost certainly use more care if they could afford it. They would use at least as much care, I would think, as the people at the top and at the bottom. So that's one piece of evidence on unmet capacity. But that was only 3 and 4-year-olds. It was 4 years ago, and it wasn't very precise. It didn't tell us exactly what they wanted. So what I did is I went out the last 3 weeks and we surveyed, we hired MassInc and we surveyed 1,000 Massachusetts mothers who have children 0 to 4 years old. And we asked them a lot of things, and I just got the data 10 days ago, and so I haven't fully analyzed it. So there's going to be a separate report coming out in a few weeks, and if you want, I'll come back and talk about that. But I put a few of the results into my presentation on Wednesday, even though they're not in this current report. And so one result we found was that of if you look at the right here, people who are not currently using any paid childcare, 80% would use paid childcare if it were free. Okay, so a big chunk of the people who are not using formal childcare now, it's not that their preference is to be home with their kids, it's that they can't afford it, and so they're not using childcare. And even among the ones who are currently paying for childcare, 71% would use more if it were free. And then I asked people how many hours they would use. Is this folks, on the right side, are these folks who, want 7 hours of a break a week, but they actually want to be home with their kids primarily, or do they want full-time care? The answer is the median person wants pretty substantial care. Median's 25 hours, the mean's 29 hours. So I interpret this as a lot of people who want substantial care who can't afford it right now. And even on the ones on the left who are using care, and the average hours they're using now are about 25, they want another 10. They want to be at 35. And I guess from a policy standpoint, what this pushes me toward thinking is we don't need to agonize over whether the optimal number is 70% in care or 80%. As many slots as we can add and pay for as fast as we can. Like the constraint is going to be how fast we can add slots. The next decade, we could add as many slots as we possibly could, and we still wouldn't get to too many. If at some point we're up at 70 or 75, and then we need to really calibrate how many of the rest want care, we can worry about that. But at the moment, there's just, as much as the system could possibly add in care, there's demand to use it. Okay. Another thing I talk about is costs and prices. Maybe I won't. I don't know. Maybe I won't spend time on this if I want to make time for discussion. You can anyway. Most of the people in this call probably understand that
Right.
it costs a lot more at infant care, and we basically you lose money in infant care and you cross subsidize by charging more for preschool care, and that leads to weird incentives. Like if we add more pre-K, we might destabilize the infant and toddler market. So I talk some about what you might do about that. Okay, we already talked about the 3,700. I'm not going to go into more on that. Let's talk about the workforce. There a slide I'm missing here? Oh, no, I see. I compressed my 2 slides into one. I forgot I had done that. Okay, so this shows both the size of the early educator workforce in Massachusetts and then what we know about the wage distribution. Here I just show you the medians. In the paper, I show you the 10th, 20th, 30th, 50th, the full distribution. But what you can see is there are about 41,000 early educators in Massachusetts, and a little more than about almost 3/4 of them are in centers, and about The rest are either family-based or pre-K. And from last fiscal year, so last spring. So think of it as February or April of 2024. Um, so the median hourly wage for a lead teacher is $21.50, or think of that as if people work full time, 2,000 hours a year, that's only $43,000 a year. The full-time annual salary for the median assistant teacher is only 35,000. Even a center director is only making 60,000. So if you step back and ask why is it that if you talk to any center director, they say they're losing their good teachers to the K-12 system, and they're losing their teachers to Best Buy, which is paying them $23 an hour and giving them more flexible hours. I mean, these levels are very obviously are not very competitive in the labor market right now. And in particular, coming out of COVID, one of the good things that's happened is wages have risen faster in the bottom third of the wage distribution than in the top two-thirds. That's something that hasn't really happened in the U.S. economy in 40 years. So that's a great thing, except if wages are rising a lot in the bottom third, and that's where we're getting the childcare workforce, and we're not raising the amounts of dollars that are going in to pay for care, it's going to become increasingly hard for center directors to recruit staff, and you would be exactly where we are. And I think that's what's going on. And in the paper, I take some data and I find people who I figure out what jobs people from census data people do, what are the most common jobs people do just before and just after being an early educator. And then I go look at what's happened to those wages in Massachusetts since 2020. And basically all the competitor occupations have had a faster wage growth than early educators in Massachusetts, with the one exception, which is kindergarten teachers. And I think what's going on there is because they're multi-year union contracts. When inflation went up, the contracts were sort of what they were, and they haven't all fully reset. So I'm pretty sure that by the next time every school district has renegotiated contracts, that will be above the early educators in the wage growth, but that hasn't happened yet. Okay, so that's what I want to say about the current state of the system. And now let me talk about the path going forward. My phone, see how I'm doing on time. All right, I'm doing pretty well.
You're doing great. This is the hardest thing to ask people to push an hour and a half into.
Yeah, no problem. So, I think the talking point probably we all use is we want to make affordable, high quality childcare available to all in Massachusetts. And I think there are four components of that. Raising the quality, generating additional slots, making it possible for families who currently can't afford formal care to afford it, and then reducing costs for families who are currently using it and paying for childcare, but for whom they're paying as a burden. So I think those are the four components, I think, of how I would interpret that expressed policy objective. And I argue in the paper that there's a sequence to how we should address these issues. I think we got to do wage increases first. And I think there's three reasons why we got to do that. One is just to stabilize the system and prevent it from collapsing and having centers not able to staff themselves. And, I was reading one report by one organization recently that says, centers try to have two teachers in each classroom and then another half teacher, but they mostly can't because they can't find enough teachers. So number one, just to keep the system from collapsing. Secondly, if we're going to add slots, we're going to have to pay more. I mean, just like we're not going to add capacity unless we've already solved the wage problem. And so that's another reason why this has to go first. And then third, there's some research from places that went very broad on the making it affordable without worrying about quality or capacity first, that ended up with unhappy results. So in particular, the big Quebec expansion about 15 years ago, there's some pretty good research that actually kids' outcomes of people who got the care were worse because they expanded low quality care. And the same thing, the Tennessee pre-K expansion, that was a randomized experiment, and there's good evidence. And the kids who ended up in the pre-K ended up with worse test scores and more behavioral problems and things like that. And so I think it's not. I think I don't know for sure that would happen if we went really broad on trying to just get as many kids in care first before worrying about quality. It's not guaranteed that we'd get bad outcomes in Massachusetts. Our system might just be better regulated or whatever. But those pieces of research make me nervous enough that I think it would probably be irresponsible to go very aggressive in opening slots before worrying about quality. And on top of that, since we got to raise the wages for other reasons, and wages are going to be the big, the biggest play on the quality dimension. I just think there's a very strong case for starting there. There are other things you need to do on quality, increasing training, credentialing, certifications, things like that. And then the next thing I think you got to do is add slots. And I think to do that, you got to pay one-time costs for centers that are willing to add slots or open new centers to subsidize that risky period that I described. And then I would say that is sort of with a 1-year lag. If you could bring on 10,000 slots this year, then you should add 10,000 new vouchers so that people who currently can't afford it can get them. And I think it would be a mistake to add vouchers before we add slots, because then you're just going to have longer wait lists and unhappy people who can't get, even though they can pay for it, they can't find a slot. And that's actually what happened. Went very, very aggressively toward making care affordable for everyone, which is fabulous, but they now have a lot of political blowback because they've been trying to add capacity, but it's a sort of a very deliberate process of getting people to open new centers. You can't spin out centers like overnight, by it's not like a manufacturing process where you just keep your machines going for an extra 12 hours and you get twice as much, output. It actually takes time to set up centers and deal with the zoning, to permission to open. There's lots of stuff that makes it there's a limit to how fast we can add new slots. So that's what I would say are sort of the 4 slots. And let me just go into detail on the wage increase one, and probably then just stop there. So a bunch of places, including Washington, D.C., and basically every province in Canada, has done the same thing, which I think is the right thing to do in terms of how to do the wage increase. So the problem when you do the wage increase is you don't want the employer to capture it. You want the take-home pay to actually go up for the early educator. And if you simply said, hey, we're going to have an earned income tax credit for early educators and give everyone $2 an hour more, suppose someone's making $24 an hour now, their employer might say, well, they were willing to work for $24 an hour. Now they're getting $2 extra from the state, so I can just pay them 22, and they're still getting 24, and they were willing to work for 24. And basically, the firm can capture the employer can capture the subsidy rather than the worker. And so and there's lots of evidence of that happening in other wage subsidy schemes. So the solution here is you got to put. So what I would argue is that the state should pay fully for a wage and for an increase in educator wages. Let's say $5 an hour times every educator. Pay that to the centers in a mechanism like C3, and then set a minimum wage for early educators that it's about $5 above the current median, so that we're sort of guaranteed that most of those dollars go to raising educator wages and not to something else. And if you sort of think about where you might target that, you could just choose a round number like $5. You could target the same annual pay as a starting BA teacher if it's an early educator with a BA, and there'd be a scale, that'd be a little bit lower if the early educator didn't have a BA. If it's the same annual pay as a starting BA teacher, that means the hourly wage is 10/12 of a teacher, because teachers work 10 months and early educators work 12 months. You could target the same hourly pay as the starting BA teacher. You could see, so think of current numbers is for a head teacher 23, $5 an hour would be 28. Same annual pay as a starting BA teacher would be 29. Same hourly pay as a starting BA teacher would be 35. So and you see to the right, this costs the state a lot of money. I'm sort of guessing that the 3rd and 4th rows are not without some major new discovery of I don't know, oil under Massachusetts or something, or some other revenue source is not gonna happen. But I think something in the $500 million range to raise educator wages is in the kind of thing that we should all be pushing for as people who care about this sector. All right, why don't I stop there, and you can tell me if there's other interesting stuff in the chat.
There's a lot of interesting stuff in the chat, and I will certainly send it to you. I think overall, a lot of appreciation for all of the pieces, how you've taken such a complex system, broken it down, your recommendations are clear. Some of like, where do we go from here? Um, I think also the charts are very compelling. So I don't know if you'd be up for sending your slides to us. We'll turn them into a PDF and post them. We'll have this recording available for folks. I think also just you've talked about the tensions that we're seeing now with the wait list. There's a long wait list. Access to subsidies right now are closed. Educators, we're working on the salaries and the C3. I also I think people just are really appreciated that how this could help inform the advocacy. There was a question about whether you've broken down the data by child age. And then there was another question about if there are studies about 3 and 4 year olds, and there are many studies about 3 and 4 year olds. And so we can maybe include some of that. But I guess just maybe a little bit, maybe one kind of perspective about the data. Like where'd you get the data? It was statewide data. The poll was statewide. So can you just talk a little bit about that?
Yeah, so what I can see in the data from the C3 system is basically, or well, anyway, I'm not gonna, they're like 7. I'm not gonna
Right.
distinguish too specifically, but basically, as part of C3, I can see enrollment for every age. So I can definitely break that down by age, number of classrooms by age, and then you can see the staffing. And then you can see the way the data is collected is the state gets the highest and lowest, asks each provider to provide the highest and lowest uh, wage rate for each position level. So like a head teacher, what's the lowest they're paying, what's the highest they're paying. And so from that, I can sort of, if there's 2, I know exactly what they're making. If they're 3, I assume the third was halfway between, basically, in how I'm modeling this. And
And then what
what
about
else?
the poll was who was in the poll?
Who was in the poll? It was basically meant to be a random sample of um, mothers in Massachusetts with young children. You never quite know whether the people who answer a survey is a random sample, but this was collected through one of the online panels. So a lot of ways that surveys are done today is not just by calling people because no one picks up the phone, but they get people to agree to take regular surveys, and
Right.
they curate a panel to be representative. And the nice thing about that, so of those folks, most of the people came from that. There were a little like 85% of the people offered the opportunity to take the survey, took it. And so what you worry about is like only people who are really frustrated with their care will take it or something, but it doesn't look, I can't prove that the sample is perfectly representative of Massachusetts, but I don't think there was a bunch of like bias from only the people who, want to say that they want a lot of childcare answering. So I think it's a pretty good sample from that perspective.
And then did you learn when folks, because you talked about how folks want, if it's available, they want it. Did they talk about when? So is it weekends, after school, irregular
Um,
hours?
So so first of all, I break that down by, I have the age of the child, so I can separately say and I ask what kind of, so what I ask is, what are you currently using? What do you want? What would you use if it were free? And it's not just would you use more hours, but what would you choose a center? Would you choose whatever? And then I say, what's the most important reason why you'd want something different? And actually, for most of them, they say it's someplace closer to their house is actually the number one thing they say.
Right? Convenience is
Yeah.
often it.
And then I do ask for people who are working what shift they work. So I
Oh,
don't
great.
explicitly say what hours of care do you want. I mean, ask how
Yes.
many hours you want, but not which hours.
Okay.
This was meant to be a 7-minute survey within a pretty small budget, so you can't keep people online for 30 minutes. So anyway, I look forward to all the other questions we're going to have after we look at these results, and then figuring out how to do the next survey to fill in the next gap.
Well, I think kind of being there Wednesday, having another conversation with you yesterday, having you join us today, we are just so grateful that you are making the time and your learning curve. And while it was a personal experience, maybe 22 years ago, the fact to have an economist really understand the ins and outs and really put the workforce first, I think feels very humanizing as people who have been doing this work for decades of our lives. So I just want to make sure we say that to you out loud and that we do want to be continued part of this conversation. We've since the report released on Wednesday, we've thought about all different topics. Like, wouldn't it be great to have a interview, a panel of directors reacting to this to say, like, this is what you found, this is what I'm seeing every day. We know Senator Jason Lewis was at the release on Wednesday, so we know that the legislature, the administration plays a role in all of this. So, Jeff, just thank you so much for your incredible work. We know you're on sabbatical this semester, so we look forward to thinking about how we can continue to both learn from you and help influence, what you're thinking about, how we use all this information going forward. But I'll give you the last word, Jeff.
All right, well, I just want to say that sabbatical is not vacation. Sabbatical just means I don't have to teach, so I have much more time to
Exactly.
do research like this. So,
That's
so
right.
it's not that like it's the sabbatical means it's weird that I'm doing this. It's why I'm able to get this done. So, and why I
Right.
keep working on this hard for the next few months. So,
But where are you on sabbatical, Jeff?
well, we are spending the whole semester except this week in India, and I fly back to India at 5 p.m. Tonight. So I will. Anybody who wants to talk to me, it's going to have to be before noon Eastern time over the next few months.
So we will keep the emails coming. And I think folks on the call, as always, if you're thinking about ideas, how we can use this information, as I said, we blogged about it, kind of just the initial release. The link to the report is in there. And then, Jeff, if you can send the slides, and then let's keep this conversation going and really think about what it means kind of for next legislative session and all the others to come. So thank you so much for joining us. And tomorrow we will be coming to you live from Springfield, where we will kind of connect you with all the other folks from the states from New England that are here. So thanks again
Great.
for everyone for
Okay.
joining us, and we will
See you
see you
later.
tomorrow. Thanks, Jeff.
Okay.